This is the 7th video in my series on what is helping me with my recovery from long COVID. In the last video, I talked about the lymphatic system and the Perrin technique. Today, I will be talking about the importance of exercise for recovery and how to safely incorporate that back into your life. Exercise can be a tricky subject with those who are recovering from long COVID chronic fatigue syndrome. A lot of us are all too familiar with our attempts at graded exercise failing, with post-exertional malaise and exercise intolerance, with how overdoing it with exercise can push us into a relapse which can take days, weeks, or even months to climb out of. But does this mean that we can never exercise? I don't believe it does. I believe that exercise is a vital part of recovery from long COVID chronic fatigue syndrome. Here are some of the many benefits of exercise. It can improve your mood and reduce feelings of anxiety and depression. It is crucial for supporting a healthy metabolism and burning more calories per day. It helps you maintain your muscle mass and weight loss. It is essential in maintaining a healthy weight and reducing the risk of chronic disease. It helps you build strong muscles and bones. It may help prevent osteoporosis. It can increase your energy levels even with people with persistent fatigue and those suffering serious health conditions. It can provide antioxidant protection and promote blood flow, which can protect your skin and delay the signs of aging. It improves blood flow to the brain and helps brain health and memory. Among older adults, it can help protect mental function. It can help you fall asleep faster, sleep better, and feel more energized during the day. It can improve your sexual health. It has favorable effects on the pain associated with various conditions. It can also increase pain tolerance. It reduces your risk of heart disease. It helps your body manage sugar and insulin levels. It reduces inflammation. It boosts immunity. It reduces your risk of some cancers, including breast, uterine, and lung cancer. It increases longevity. If you are not moving at all for months on end, this sends negative messages to your body. But if you are moving regularly, even a little, this sends messages of health and healing to your body. Exercise is extremely beneficial to our overall health. So how can we safely begin to bring exercise back into our lives as we recover? And what types of exercise are best to start with? As I explained in earlier videos, I believe that long COVID chronic fatigue syndrome is a nervous system dysfunction, and as we heal our nervous system, all of our symptoms will resolve and we will fully recover. But when you are still in that place of nervous system dysfunction, a very overstrained nervous system, all types of stressors can be too much for your nervous system to handle and can make your symptoms worse. Physical stress in particular is hard on the nervous system, and that is why we often experience setbacks after exercise. But with everything with this recovery, it's all about finding balance, being patient, and slowly taking small steps forward. I think at the beginning, it's better to refer to it as movement rather than exercise. The word exercise can make us think of strenuous activity, whereas movement, just gentle activity, is what is best for the body and the nervous system as we recover. We want movement that is beneficial to our overall health, but is low impact and easy on the body and the nervous system. You don't want to attempt anything that is too intense and will overstrain the nervous system. 3 types of exercise or movement that have helped others with their recovery from long COVID and chronic fatigue syndrome, and have helped me personally, are walking, yoga, and strength training. Low impact, gentle walking is very good for the body. It is easy on the body and the nervous system and is beneficial in healing both. You also get the added benefit of the healing environment of the outdoors, fresh air, and nature. Gentle yoga is brilliant for the body and the nervous system as well. There are so many healing benefits from practicing yoga. Light strength training is also good for healing the body and slowly building strength back up. In my video about pacing, I talked about finding your baseline of energy and then slowly increasing activity from that place. I've taken the same approach with exercise. You find your baseline of activity and then very slowly and carefully increase it. I will tell you what has worked for me. After about 9 months of no exercise at all, I decided I had to start somewhere with bringing it back into my life. I decided to start small and increase it really, really slowly. I live in the country and there are lots of little lanes and footpaths and different sized loops by my house. I decided to take however long it would take to make it around the smallest loop near my house. So I started with 1 minute a day for several days, and then I added another minute, and then another. And over the course of several weeks, I was able to very slowly increase my time until I made it around the loop. It was only about a 10-minute walk, but it felt like such a huge accomplishment. And then I slowly increased my goals, knowing that ultimately I wanted to be able to be where I was before I got ill. I used to walk at least half an hour a day at a fast pace. So over the course of several months, I slowly increased my walking time and then slowly increased my pace. It took me about 7 months to get where I was before I got ill, but I got there. I'm now able to walk for at least 30 minutes a day at a fast pace, and I've been doing this for many weeks. With the yoga, I started with just 5 minutes every morning and then slowly increased the time and difficulty. I'm now up to a 20-minute session every morning and every evening. And with the strength training, I would work on my upper body and my lower body on alternate days with a break on Sundays. There was a weights routine that I did before I got ill. I started doing that, but with no weights, just my arms. And I started with just 5 reps. And then over several weeks, I worked my way up to the full reps. And then I started using the lightest weight I have, 1 kilogram. And I started with 5 reps and worked my way up to all of the reps over a couple of months. And then I added more weight. I did the same with my lower body. Just 2 squats to start with, then slowly increasing and adding more, and then lunges and other exercises. So over many months, I very slowly increased my exercise until I was back to where I was before I got ill. And amazingly, I'm now able to do even more than I was doing before I was ill. So now I'm going to talk about how to navigate the setbacks that you can experience as you begin to bring exercise or movement back into your life. You want to enter into this with wisdom and as a student of your body. One of the biggest lessons I've learned through having long COVID is how to be really in tune with my body, how to really listen to my body. So every time you add anything to your routine, you want to be really listening to how your body is responding. And if you ever feel at any moment like it's too much, then you just stop and know that you can try again when your body is ready. You never ever want to push through with exercise because that is ignoring your body's signals and will most likely end up making you feel worse. You never want to strain your body. Your movements need to be gentle, steady, and controlled. If you ever do feel worse after adding to your routine, then simply pull back and take a couple of days to fully rest and let your body recover before you continue. It's important to be aware of how your body is responding, but at the same time not to be afraid of possible setbacks, and to not be afraid if you do experience a minor setback. To know that this is all part of the recovery process. If you enter into the whole thing with a lot of fear and are constantly fearful and anxious throughout, this can have a negative effect. Fear and anxiety send signals to your nervous system to stay in that fight or flight mode, which only perpetuates the nervous system dysfunction. I'm not talking about repeatedly pushing yourself into full-on relapses. If you do that, it will end up making your recovery take a very long time. I'm talking about it being okay with sometimes being 2 steps forward and 1 step back. About it not being linear and perfect, but sometimes up and down. Always keeping in mind that even if it is 2 steps forward and 1 step back, you are still moving forward overall. If you ever do feel worse for a few days, just try to take it in your stride. For me, when this has happened, I just listen to my body and I don't do any exercise at all for a few days, and then over a few days, I slowly get back to where I was, always letting my body lead me. If you ever do experience a full-on bad relapse, remember that even this is part of recovery from long COVID and chronic fatigue syndrome. You don't want to be having them all the time, but if you do have a couple of full-on relapses, know that it's okay. You will be okay. Just listen to your body and take the time it takes to recover from your relapse. I've only had 1 relapse in the months since bringing exercise or movement back into my life. I'd been doing extremely well for several weeks, and then one evening had all of the bad symptoms come back. It was really hard to experience this after feeling so much better, but I kept in mind that this is something that can happen and it's not the end of the world. And so I stopped all exercise and rested much more than usual, and then slowly increased my activity and movement over several weeks. It took a while, but I got myself back to where I was. In a relapse, you want to have the mindset of treating yourself like you would a loved one who is ill and who needs your care and kindness. Treat yourself with extra love and compassion, and try to keep a positive mindset, knowing that you will get through it, and ultimately navigating the setbacks makes your whole recovery stronger and more robust. I just want to add here, for women with long COVID and chronic fatigue syndrome, just to be extra gentle with your body when it's your time of the month, as this is when setbacks and relapses can occur because of what your body is already going through. You just want to pull back during those days and let your body have a break. So bringing exercise or movement back into your life is completely possible and really important for your recovery. Just do it with wisdom, patience, and a positive attitude, always listening carefully to your body. I went from months and months of no exercise or improvement at all and was able to slowly build up to being able to do even more than I could before I was ill. And it has been so good to experience all of the benefits of exercise or movement as I recover. To feel my body getting strong again is just the best feeling. So that's all on exercise. Next time I will be talking about the importance of stress management for recovery.